Community and public health role and responsibilities. Community and public health, the role of public health professionals goes far beyond communication. We have to be responsible and accountable for educating and advocating for our patients. It is up to us to make sure they get the best quality of care available. We use all resources available to us to help and assistance in the well-being of patients of all over this world. It is our duty to protect our environment as well. We must identify health problems and ensure safety. Organizational structure. The organizational structure are administrative people that starts with local, state, and government agencies. They continuously communicate with the government. They gather information from state and local offices for their findings. They base their decisions on what nurse practitioners, physicians, and policymakers have to say. According to Hyde J.K., more research is needed to help policymakers determine how to build an effective and equitable system with limited resources. Legal and ethical services. Legal and ethical services is what keep the public health and community services grounded, because you must have some guidelines to produce the information you get out to the consumers. They have to make consumers understand the laws and rules of the health departments. According to Public Health, new findings from McGill University in the area of public health describe public health issues with complex legal and ethical dimensions which impacts ability to access services far beyond gender sensitivity. We as a people ensure that the conditions of our patients are to be healthy, and by doing so we must enforce healthy habits and a better way of living. Funding services. Majority of the funding of public and community health services are through our tax dollars, but making sure they are going where they need to go is up to our government. According to the analysis of the Health and Human Services budget, the 2013-14 governor's budget proposes $20.3 billion from the general fund for health programs. This is an increase of $668 million, or about 3.4% above the revised estimated 2012-13 spending level as shown in Figure 1. The net increases reflects increase in caseload and changes in utilization of services, as well as the impact from major ongoing initiatives. Communication in the community and public health programs. Channeling the information to the proper authorities is how the consumers get the information, whether it's through television, radios, ads, or word of mouth. They try to inform and educate people so that they are aware of the changes that take place in the country. According to FRIS, the essential public health services including monitoring and reporting on community health status, investigating and controlling disease outbreaks, and educating the public about health risks. Community and public health services enforce policies to improve on the health and well-being of our patients. This includes people all over the world. According to Balcazar H., to date, community health workers have shown their effectiveness in high-priority health care issues such as managing chronic diseases, improving birth outcomes, and maintaining child wellness. All of these are reasons that we need the help of the community and the public health system.